of this webinar, that is Psychologs, for giving us this opportunity. I read on your website that this is India's first psychology magazine. I appreciate these youngsters for initiating this and wish them all success in their endeavor. We are here to address you all as 10 September is observed as World Suicide Prevention Day every year. This gives us an opportunity to raise awareness of suicide and to promote action through proven means which will reduce the number of suicides and also suicide attempts globally. The theme for this year is creating hope through action. This provides us an alternative to suicide, which means that people, through our actions, no matter how big or small, may provide hope to those who are struggling. If we look at the world statistics, 1 in every 100 deaths is the result of suicide. And every year, suicide is among the top 20 leading causes of death globally. And the leading cause of death for this, what is the cause for this suicides, higher number of suicides is depression is the one of the leading cause. So since we can treat depression and we can always prevent suicides. So depression is treatable, so suicide can be preventable. Nowadays, stress levels are on the rise, be it among students, young professionals, executives, or even homemakers. Coping with deadlines and multitasking, finding a work-life balance is taking its toll. All of us can play a key role in preventing suicides. We all, through our actions, can make a difference to someone in their darkest moments. You may ask a question, how do I help someone, as I am not a psychologist, counselor, or a mental health professional, that I don't have any skills in this field. Absolutely not necessary to be any one of them. All you need is a compassionate and caring attitude towards others. You can give someone hope by showing that you care. We may never know what we do that makes a difference. A small talk can save lives and create a sense of connection and hope in someone who may be struggling. Roshini is one such voluntary organization based in Hyderabad, Telangana state in South India. Our cause is supported by Dr. Reddy's laboratories. And we have been providing free, confidential, emotional support for the depressed and suicidal for the last 23 years. An NGO to survive for 23 years is not easy. We have 2 helplines that are open from morning 11 o'clock to night 9 o'clock and on all days of the week. One can call us on our helplines or connect with us through email also. We used to see people at our center. Anyone can walk in, they don't need an appointment. And because of the COVID situation, we are operating remotely and we are accessible only through helplines and email. We have about 60 to 65 volunteers, dedicated volunteers working selflessly. Our volunteers speak many Indian languages, which is in turn helping us to reach out very far and wide. And our numbers and email ID will be displayed towards the end of the session by organizers. Now, I'll ask Mrs. Tinky Bhardwaj, a very eminent speaker, very senior volunteer and ex-director of Roshini, will speak on the topic, a mental health first aid, introduction to GateKeeper training. Now I'll ask Tinky Bhardwaj just to speak on this topic. It will be very, very interesting, and she is a great speaker. Let all of us listen to her.
Thank you so much, Ushashree. And thank you, Psychologs, for this opportunity to empower us, to empower others, to empower those who are not mentally feeling very up to the mark, those who may be depressed or suicidal. So it's a great team effort, I would say. So a very good morning to everyone here today. Today's topic, as you know, is mental health first aid. So what do we mean by mental health? World Health Organization has defined mental health as a state of complete physical, mental, and social well-being, emotional well-being. It's not an absence of disease or infirmity. Good mental health improves the overall quality of a person's life because our mental health affects how we think, feel, and act. It determines how we interact with others, the choices we make, how we handle stress, how we cope with adversity, how do we adapt to changes, how resilient we are. Can we bounce back and not go down under? It also determines our efficiency and productivity at work and whether we can make a meaningful contribution to society, which I think is extremely important. So, but we also know that mental health disorders are on the rise and they are associated with distress and problems for the person functioning at work, in society, and at home with the family. And one such disorder is depression. So what is depression? We just tend to use it in a very loose term, but depression is a serious medical condition. It is characterized by extreme, pervasive, persistent sadness that is out of proportion to the event or situation, and a complete loss of pleasure in things. Sadness is an emotion, but depression is a mood disorder. So there is a difference between the two. In fact, stress is a state of mind. It's a mind-body reaction to stressors. Anxiety is a natural reaction to the stress. Persistent, excessive worry about uncertain outcomes. The person thinks, what if? They're imagining the worst possible outcomes. Depression is a medical condition, a mood disorder, longer lasting, will need medication and sometimes difficult to treat because the person suffering from depression either does not take the medication or stops it when they start feeling better. But depression is not a biological disorder, though it has biological effects. It can lead to chemical changes in the brain. Sometimes it feels like a physical disease because of the accompanying pains. There is lack of sleep and weight changes, and the person feels exhausted. There are inexplicable aches and pains. So that is why sometimes it is misunderstood to be a physical disease. Depression affects the whole body. It impacts how one feels, thinks, and acts, one's normal functioning. It is not a personal weakness or a character flaw, and a person cannot just snap out of it. Primarily, depression is of two types. Either it's clinical depression that requires medication and therapy, or situational depression, which comes about because of extenuating circumstances, continuous stress, pressure, inability to cope. But after a reasonable time, one can get on with life. And emotional support is very necessary to deal with this type of depression. And that is where the service that Roshini provides. There's also masked depression, where people look good but feel sad, but nobody knows it. It's all hidden. And of course, seasonal affective disorders also there. There's what could be the causes? One is life events, unfortunate experiences or circumstances which continue for a period of time, and it could lead to either a single episode or recurrent bouts of depression. Also, postpartum depression, which is due to hormonal changes after a childbirth. Very often grief reaction to a loss of any kind, where the person is just not unable to accept the loss of a loved one, or maybe it could be finances or a job or any kind of loss. And when that grief continues over a period of time, a person may slip into depression if they don't get the emotional support during that stressful time. There could also be a threat which leads to depression, like failure or terminal illness or financial responsibilities which the person is not able to meet. Sometimes depression is a part of a mental illness or a depressive personality disorder, and the side effects of some medications. And what really creates a cycle of depression is negative thinking styles. And people tend to see everything very in a pessimistic way, in a very negative way, and that becomes a pattern of behavior. Also, continued stress can lead to depression. So when a person knows that they're overworked, overstressed, it will be visible in the bodily reactions, it will be visible in their emotions, it will be visible in the way they behave and interact with others. It's much better that you handle the stress rather than letting it lead to depression. Now, what could be the symptoms? So at 4 levels, at the cognitive level, it alters the way a person thinks about themselves, about others, and about the world. So either they will say, I'm no good, I'm useless, one failure, one setback, and they say life is over. So they take it in very extreme, they take a very extreme view of everything. That could be about oneself, about others, or about the world. They have a gloomy view of the future, and very often there are recurrent thoughts of death or suicide. So that's not because they want to end their life. It's because the psychological pain is so unbearable, so unmanageable, that they feel they cannot cope with that pain any longer. And it also affects a person's memory and concentration, that they have trouble making decisions. They have difficulty even in organizing their thoughts. Very often it comes from poor self-esteem. And poor self-esteem comes from self-beliefs, what they've started believing about themselves. And that is, I'm no good, I'm worthless, I'm incapable, I don't think I can do anything. And that, makes them feel very sad. So at the emotional level, there is despair and hopelessness, helplessness, restlessness. Sometimes there's frustration or anger. There may be mood swings. Also, they may become numb because they're just so tired of battling that. And there is a reduced interest in all activities. This thought process plus the feeling, it becomes like a self-perpetuating cycle. So the negative moods leads to lack of confidence, poor performance, then that leads to poor feedback or appraisal. And then it strengthens their belief that, I'm no good, I'm worthless, I can do nothing. So the thoughts and the emotions go hand in hand, and that can lead to depression. At the biological level, physically, they feel very tired, there's lack of energy, their sleep, weight, appetite, everything is affected. And of course, all of these things reflect in the way in which they work. That is, they're not effective or productive. And at the behavioral level also, it could lead to self-harm, self-injurious activities. Now, so many things have been mentioned. So if one of these symptoms is present for a day or two, we cannot surmise that person is depressed. So at least 5 or more of these symptoms must be present continuously for a 2-week period, most of the day, nearly every day. So for 2 weeks, for 15 days or more, the person has at least 5 symptoms, almost the full day, maybe during the night, and every single day. And the people around, the family, friends will notice that there is a change, something has gone wrong, this person is not himself or herself. Seems to be like a personality change. And at least out of all the symptoms, one of the symptoms would be extreme sadness. So sad that sometimes people who are depressed cry and they don't know why they cry. They seem to be crying for no reason at all. Or there should be a complete loss of interest or pleasure. Nothing interests them. Even something they've been very passionate about no longer holds their interest. So how does a depressed person cope? They could use either adaptive strategies like sharing, either they recognize or someone tells them, look, there's something wrong, you better seek help. So they share their concerns, they seek guidance, they may meet a doctor. Also, they take care of themselves, they manage their stress levels so that they don't spiral down to the point where intervention is needed. Or they can use maladaptive strategies like indulging in substance abuse because they need to numb themselves. So when someone wants to numb themselves, it's because they can't cope with the pain that they experience within. And it could also lead to reckless behavior. They don't seem to care kind. So why don't they seek help? If they know they are depressed, or if somebody tells them something is amiss, mainly it is because of the stigma. They would seek help, if there was, if they had a toothache or they had a, fracture or something. But for this, either they don't know, there is lack of awareness, or they are in total denial. The family is very often in denial. They say, no, it's nothing. You're just making a fuss about everything. The stigma and the shame. Also, when a person is depressed, there is no energy. So they just don't have the energy to go by themselves to seek help. They don't know whom to tell. There's limited access to professional help. And of course, no support from the family. As a lay person or a gatekeeper, what are the things you could do? Firstly, don't try to cheer them up or criticize or shame them or sympathize and say, poor you, I feel sorry for you, or get angry with them and say, come on, just snap out of it. Because none of these things work. They only make the depressed person feel more sad, more depressed, and more lonely because they feel there's not one person who can understand what I'm going through. If they are willing to talk, and if you notice there is something amiss, then please encourage them to share their concerns, listen attentively, and of course, don't minimize or belittle them. Help them to seek professional help before they reach a crisis stage. So what can help actually for a person who is depressed? If it is a situational depression, normally, if the situation changes, the person slowly comes out of it. And sometimes it continues, but anyhow, half of depression disappears in 6 to 12 months. So a person who knows this is what causes stress and for me and makes me feel really depressed, avoid those stressors. Also, when a person is depressed, avoid making long-term commitments or decisions or changes. Because a person who is depressed does not have the wherewithal to really think things through clearly. They're not able to. So important that you guide this person, a friend or whoever, to see a physician if there are, or a mental health professional, even if mild symptoms are present. Because the earlier it is treated, the better. Evaluation is necessary. And remember that it is a treatable condition. It is a high risk factor for suicide. And the surprising thing is, when a person is depressed and feeling very low and fatigued and exhausted and seems to have no energy, that is the time when they seem to be a little safer than when they seem to be getting better, they seem to be normal, they seem to be back to their, energetic self, because that is when they are more likely to attempt suicide, if at all they have planned to do it. So that's when one needs to be very alert. Now, depression is the leading cause of disability worldwide, and over 5 crore Indians suffer from depression. So remember, whether it is ourselves, any one of you or your friends or family members, anyone you know who you think may be depressed, it's important to reach out. Don't try to cope alone. Don't try to be the therapist. Reach out, seek help, encourage them to talk, because that emotional support goes a long way in helping them to cope. So this brings us to the topic of suicide. Why does continued depression lead to thoughts of suicide? Why does someone want to attempt suicide? It is actually a form of problem solving, because a person perceives a dilemma as unsolvable, inescapable, and they kind of develop a tunnel vision where they think, now this is my last option. This is the only way out from this unbearable pain, from this very difficult and painful life, which I can no longer live or cope with. So they feel an utter loss of control. So there's complete helplessness, also a sense of personal failure, that, there's nothing I seem to be able to do that would help me to deal with this. So when they can't cope any longer, then they may resort to suicide, but they do that only as a last resort. If there was another alternative, they would not commit suicide, because they don't want to die.
Sorry, ma'am, to interrupt.
Yeah.
So sorry, ma'am. So sorry. There's some glitch from the back end. So I would request if everybody could pause for 2 minutes.
Okay. want to die, but because they want to stop hurting. How does a suicidal person feel? Hopeless, helpless, lonely, and worthless. These are the predominant feelings. Lonely, because no one understands what they are going through. Nobody even wants to hear it. Normally, if they talk about it, people either laugh it off or they say, come on, let's go out, and they try to look for some way to entertain them. But that does not remove thoughts of suicide. They also feel extremely sad, they're pessimistic, depressed, and may have mood swings. Sometimes they are so distressed and anxious that they become agitated and desperate, and they may get suicidal thoughts, which can gradually change from fleeting thoughts to recurring and persistent thoughts. There's also a dysfunction in logic and perception, so they're not really able to think rationally or clearly. What we need to remember is suicide is not an impulsive act. It is well designed, it's well thought out. When suicidal feelings start arising and thoughts become more and more persistent, it reaches a point where it seems to be the only option. And that's when plans are set in motion, they start acquiring the means. When everything is in place, they have decided this is how I will do it, this is when I will do it. They then calm down, they postpone the final act, and then some little thing can just trigger it off. So one needs to be very alert. The warning signs of suicide. Remember, everyone who commits suicide will talk about it to at least one person before they finally do choose to end their life. Unfortunately, nobody takes that warning seriously. So verbally, they may directly say something like, I want to die, I wish I were dead. Indirectly, they may hint at wanting to commit suicide, like, I can't go on, no one really cares, nothing matters, there's no point in living. So be alert to all of these hints that they might drop, because they're waiting to see how the listener is responding, reacting. Are they going to believe them or not? And they feel so hurt when no one believes them or takes them seriously. So don't miss the signs. Behaviorally, they withdraw, they become quiet, they don't want to meet because they are busy. Ambivalence is one of the hallmarks of a suicidal person. So they want to live, but they want to die. It's like the pendulum which swings up and down. And that ambivalence creates a lot of restlessness and agitation. We all know when you can't take a decision, should I do this or not? Should I do that, or should X, or should I do Y? That uncertainty definitely disturbs all of us. And here it's such a big decision. It's about, should I live or should I die? So anyhow, they start acquiring means, they start giving away prized possessions, they may write a will. See, in old age, everybody does. Sometimes youngsters start writing a will, or they say, will you take care of my pet if something happens to me? They may call friends and say, I haven't spoken to you for a long time. I just want to thank you. You've always been there for me. It's been so good knowing you. Now, out of the blue, if someone does these things, definitely, it's time to be alert and to figure out what could be going on in this person's mind. They may also read, write, or talk about suicide, and they may become very impulsive, aggressive, violent, and there may be a noticeable change. Suddenly you notice this person had become so agitated and disturbed, and now he's become so calm. He's almost like he's become normal. And we start thinking, thank God, it was just a passing phase. He's out of it. Now there's nothing to worry. In fact, when that happens, it is probably because this person, for them, the ambivalence has now come to an end. They have taken a decision that this is it. I am going to finally take that fatal step. And that is a very critical time. At that point, they should not be left alone. 36 to 72 hours when suicidal feelings peak is a crucial time when emotional support is necessary. We often get calls from people at Roshini. They tell us that, we've decided we're going to end our lives. We've already got whatever is the means, whether it's pills or whatever else. But we just thought that we would like to once call Roshini and talk to them. So if somebody has decided to end their lives, why would they call Roshini? Because they're just hanging on to that slender thread that somebody would reach out and hold their hand. Someone would reach out and pull them back from the brink of taking that final fatal step from which there is no return. There's no going back. Once done, it's completed. So they are still, even in that last moment, they are not giving up. They are still wanting that something may give us a reason to live. And that is what Roshini volunteers do. We don't argue. We don't tell them stop it. We don't say you can't do this. It's wrong. It's immoral. It's irreligious. Nothing. We only keep focusing on, we understand your pain. We know it's unbearable. Nothing seems to be going right. But is there at least one thing, even the smallest of things, that might make you want to live? Very often it is the family, or there are children, or something that holds them back, that it's because of this that I can't do it. But sometimes they may even cross that and say, forget everything. I'm just going to do it. Also, situations can act as triggers. So a loss or bereavement of any kind, anticipated loss of financial security, diagnosis of serious illnesses. So often we read about patients, especially now in COVID time, where they have actually jumped off the hospital, the floor, because they felt, if this happens to me, my life is over. And unwanted pregnancies, there are umpteen reasons, different reasons for different people. The thing here is, there could be many people who have the same circumstances. They're going through exactly the same thing in their lives. And yet some of them are able to cope, come out of it and move on. And others just give up and say, that's it, no more, I can't cope. We've even had calls from people who have said, my life is so perfect. There is nothing I lack. I have a great family. I'm well educated, no financial problems. I have a secure job. I'm well respected. I've been a leader in my own right at various levels during my education. But there's nothing that makes me want to live, nothing at all. So we do have people who feel that way also. So there is I cannot give a uniform thing that everyone must have these reasons and only then they will. Because behavior is unpredictable. How people think is unpredictable. What they feel is very different. So we can't become lackadaisical and say it's okay. So risk factors are also there, like mood disorders, mental illness, depression, substance abuse disorder, people under the influence of alcohol or drugs. At that point, while they're under the influence, they could perhaps take that fatal step. Previous attempts that they make increases the suicide risk. Family history of suicide. So they feel this is the way that one copes with insurmountable problems. Also, the influence of peers and celebrities. And very often, no access to mental health professionals and no emotional support. Sometimes they're all alone. They're living, we get to hear from a lot of youngsters who have moved to Hyderabad, for example. They are working, they don't know the local language, they have no friends, they feel so lonely. Sometimes they really reach the point where they say, I'm just so depressed, I'm just so lonely, I can't go back home. So what's the point of living like this? So be alert, be aware. Notice very, very small, they could be very insignificant changes in the behavior, in their personality, in their appearance. They may appear unkempt and they couldn't care less, something. Be alert to these signs and do reach out to them. But how would you ask someone, can you directly go up and say, hey, you're looking sad. Do you think you're going to end your life? We don't do that. We can't do that. No. If they start talking about it, then you could ask at a correct time in the conversation that you've been mentioning this often. Is something amiss? I mean, are you finding life so difficult that you don't want to live anymore? Very indirectly. And what happens is that person feels that the anxiety comes down, because at least here is one person who's willing to take them seriously, who's willing to give their time to listen to what is happening to them, what they're feeling, what they're going through, how they're unable to cope. And that is so reassuring. And in fact, that could be the one thing that brings them back from the brink of taking that fatal step. So it's important to assess how close they are to actually making an attempt. So, do they just have any thoughts? Do they have any plans? Do they have the means also? So I know, how often do you think about it? What's going on in your mind? Is there something that I could do? So assisting them is also important, and also help them to see the consequences of their decision. You seem to feel that your problems are insurmountable and this seems to be the only solution. Help them to also recall past instances where they could cope, where they were able to do whatever was necessary, and problems do go away, circumstances change, situations change, but suicide is permanent. So everything else is temporary. This is a permanent step that they are wanting to take. So help them to see how it might impact the family or a loved one, but in a very, very gentle and very caring way, without really being judgmental. Now, when we talk of suicide ideation, are those thoughts fleeting? Do they come and go? Or do they keep coming back? Or have they become persistent thoughts where they're there all the time, day and night? They just can't get out of those thoughts. So when did those thoughts first come to the person's mind? What triggered those thoughts? How long have they been feeling suicidal? And what do they do when that thought comes? Because that tells you about their coping ability. Currently, what is their level of suicidal intention? And what are the things that trigger the thought of suicide? Is it that one thing? It could be violence or abuse or sexual abuse or something being put down, that every time that happens, they say, I can't live like this. It could be many things, or one thing also. And also there is something that is stopping them from actually committing suicide. And that thing which stops them from taking the fatal step is actually a protective factor. So whether it's a family or the children or an aged parent, it could be anything. That becomes a protective factor, so that they actually hold on and they postpone. The thought comes, but they say no. Be there to support you until the time that you can, you can walk on your own, till the time that you can cope with things alone. And their coping skills also tell us about their desire to live. That, when this thought comes, I just go out of the room, I don't sit alone, I go and sit with family, or I go and play a game. So that means whether they're doing it deliberately or inadvertently, they're actually taking some step to get out of that zone of wanting to end their lives. And they're trying to either seek or ask for help. So it's important to explore their reasons to live. If there are more reasons for living than for dying, then definitely they are a little safer.
Tinky, do you want to continue with the same slide, or?
I just changed it.
Okay.
Okay. So just to dispel a myths, suicidal persons are always ambivalent till the last minute, and they will seek help immediately, either before or after attempting suicide. So they even call, after having taken pills, they'll call Roshini and say, please help me, I've done this, but I don't want to die. Or they'll call and say, I wanted to die, but I want to talk to you also. So that means that they want to live. And if we ask someone about suicide, that what is it that you feel there's no point in living, it will not encourage them, nor will it give them ideas. What it does, it lowers their anxiety. And this is a myth that only professionals can help. Even a lay person can, just by being there, by giving emotional support, can help, but don't be the therapist. Treatment needs to be given by the professional, mental health professional. So you need to encourage them to get that help. When people talk about suicide, don't act shocked. Don't argue, don't dare them and say, don't talk, you just threaten, you never do anything, because that one little statement can actually push them over the edge. So that should never be done. Take them seriously, listen to them, give them a chance to talk. And that is the best service that anyone can provide to someone who is in emotional distress. Just being there. You don't have to say much. You might wonder, what will I say? Don't say it. Just be quiet. Just listen. Your being with the person is much more important than what you can do for the person. Discuss options and alternatives and help them find a reason to live. It could be some dream or a ray of hope that they say, I will live despite the problems, despite my painful situations, because all of this will change one day and I am going to face it and come out a winner. But of course, don't leave them alone when they are talking about it. It's difficult, I know, but if they may try to sway you to secrecy, don't tell anyone, I have shared it because you are my friend. So if they do say that, you have to tell them that, look, if anything that you tell me is in any way going to harm you, then if it's a threat to your life, then I cannot keep it to myself. So let's together seek help. And that makes them feel they're not battling it alone. So together seek helps means we can talk to the family. Who is the person who will understand, who is receptive to what you say? We can seek, talk to a counselor, or of course, Roshini is always there, and it's a free service. It's confidential, and they can just call or mail also. And if they say they've got the means, it's very important that the means are removed, distanced, thrown away. Not put away. Like if there are pills, you don't say put it away. No, flush it away, so that it's not easy for them to just grab that means and go ahead and actually end their lives. But in doing all of this, a non-judgmental and empathetic approach is extremely important. So anyone who feels suicidal should not try to cope alone. Because it's important to reach out, seek help, and talk. Remember, suicide is not a wish to die, it's a cry for help. So be alert to the signs, and you too can prevent a suicide and save a life. So this brings us now to the topic of mental illness, which is another high risk factor for suicide. There's a very fine line between normal and abnormal behaviors. Mental illness refers to a wide range of mental health conditions that affect one's mood, thinking, and behavior. And each mental illness has its unique symptoms, and some of the symptoms overlap, which is why it is so difficult to really diagnose, especially for a lay person. It's not possible. What are the effects, or what are the signs, actually? There is difficulty in daily functioning. So when this happens, you know what happened. Why is this person not able to function normally? So it could be a symptom, but it is also an effect of a mental illness. They're unable to adapt or adjust. There is distress to themselves and the family. They cannot develop or maintain social relationships. It affects their physical health. They are so tired, fatigued, maybe because of the medication. Sometimes they get palpitations and breathlessness, like in panic attacks. They feel drained. And the most difficult of all is coping with the stigma attached to mental illness. of people judging them, of people marginalizing them, of their being not treated as if they are normal. Remember, when a person is physically ill, there is suffering. Okay, physically there is pain, but that suffering is visible. So the person is given that care, the support, they're given rest, they're looked after, they give a break from work. Mental illness is invisible. There is no match between the internal world of the mentally ill person, what they are feeling, what they're going through, and the outer world. They appear to be normal. They can fake a smile, crack jokes, and they'll always say, I'm fine. They don't want to be a burden. They don't want to be marginalized. So they always pretend all is well. But what happens? People, especially family, close friends, will blame or accuse them, put them down, say you're just being lazy. And remember, you can never fake a mental illness. One can fake being okay. I may be very unwell, but I may say, oh, I'm fine. I can fake it. But a person who's mentally ill cannot fake it. So under the umbrella of the spectrum of mental illnesses, there are some which are, there is caused because of a disturbance in the brain function, like schizophrenia, anxiety disorders, panic attacks, OCD, and etc. And mood disorders like bipolar, manic depressive. That is when they swing between extreme happiness, excitement, and racing thoughts to very depressive thoughts, sad, and feel very tired. And clinical depression also is because of that, disturbance in the brain function. Then there are disorders of the self in relation to others, like personality disorders, addictions, trauma-related, and disorders of self in relation to the community or the society, like conduct disorders and antisocial disorders. Here again, the symptoms, I think there's some disturbance, some mute, please. Please mute. Can you kindly mute? The symptoms of mental illness are very similar to those of depression and suicide, whether they are emotional or cognitive or behavioral. It's the same thing: prolonged sadness, apathy, withdrawal. But in mental illness, they may have hallucinations, they have sudden fears, excessive anxiety, and they're very tired of battling their own minds. And also at the cognitive level, there are thought disturbances. There's a disconnect with reality. They may be suspicious, there's illogical thinking, uncontrolled thoughts, disoriented, irrelevant talk. They can't focus. There is low attention. And, they'll talk things which are totally irrelevant. There's no context to what they speak. And behaviors, of course, reduce self-care, compulsive acts. Again, like in a person who's suicidal, maybe angry, impulsive, violent behaviors, sometimes self-injurious acts also. Now, as a layperson, we cannot see these behaviors, even if many of them are there, or we can't take anything in isolation, or we can't put them together and say, okay, this jigsaw puzzle is complete, now I know. We can't. We are not trained to do that. They need a psychological assessment and intervention by a psychiatrist. Only a psychiatrist can give them medication and do an assessment. There is the family role in this. They play a dual role, because the person who's mentally ill either doesn't know it, or if he's realized, he's in denial, so he hides it. If they do talk to the family, then the parents become, the family is in denial, or they don't know. But at the same time, they need to take care, because this person is not behaving normally. They have to take care. They are caregivers, but they refuse to accept it. They refuse to seek help. So they become emotionally drained. So it's important to educate not only the person, but the family, that They must take mental illness seriously. They must seek help, even if they suspect it. Because at the beginning, it is much better than waiting for it to manifest in greater forms, different forms. And also how to be the caregiver. Again, here, why they don't seek help, especially the person or the families, because of the stigma. They're afraid of being labeled mad. They say, "Ye to pagal hai." You know, you tell someone, will you go to the counselor? Would you like to? Why am I mad? Why should I go? I think you only better go. This is the lay person's view of the importance of seeking help for any mental illness or any mental issues. And so they just don't want to do that. So again, for the lay person, direct them to seek help to a psychiatrist. And they call Roshini for parallel support. So many people who call us are actually on medication prescribed by a psychiatrist. They have a mental illness, but they call us because the family is unable to cope. Family is tired of hearing their irrelevant talk, they're disoriented, disconnect with the reality. So they often call us, they just to talk for a few minutes. It's like we are like a lifeline, some place where they talk, they're listened to with respect. They say what they want to. We just empathize with them. We cannot do anything. We check, I hope you're taking your medication. And that kind of keeps them going. It keeps them grounded. That is the one thing that, I must call Roshini, because at least they respect me and they listen to what I have to tell them. Peer support also helps in supporting the mentally ill, especially in mood episodes, because the family is again tired, exhausted, and anything they do or say, the family says, "Oh, again, you're in one of your moods today." So if the peer support is there, then they feel a little, relieved. They're able to release that, whatever it is within them that they need to talk. But be very sensitive, use your words very thoughtfully, be kind, compassionate, be genuine, and empathetic. Don't be harsh, don't label them, don't call them names, because that is something that would hurt them so badly that it would actually make them feel much, much worse. Sorry. So what is the impact of being judged? They start feeling a sense of shame. They feel so guilty. They feel hopeless. They feel numb because they cannot cope. There are two things they need to cope with. One, the knowledge that I am mentally ill, and the psychological pain of dealing with that illness, pretending to be okay, not being accepted, being in denial, being put down. Together, it's absolutely something which is impossible for them. And when they think about it, they start, believing I'm unlovable, I'm a burden, no one understands me, no one really cares, and I don't think I can reach out. I want to, but my family's name will get spoiled. So everything has to be swept under the carpet. And of course, so they withdraw and they keep pretending I'm fine, I'm okay. They hide the symptoms. So because they don't seek help, mental illness is not diagnosed until sometimes it's too late. It could lead to, even suicide attempts. So don't solve their problems or provide suggestions or give advice or be their therapist or belittle them in any way, especially things like, don't say, just snap out of it. Come on, stop looking for attention. I think you're being too negative. There's nothing wrong with you. Stop feeling sorry for yourself. It's all in your mind. These are not nice things to say. Yes, it is in the mind, but they can't help it. They cannot control the way that they think and feel. There is a disturbance in the mind. And remember that it is not a choice that they have made. It is neither a weakness nor is it an emotion. So mental illness is not something to be ashamed of. So it's important to talk about it, to seek help. But why they can't is because it's difficult to describe what is going on when you don't understand what is going on. something is wrong, but I don't know what it is. I know there's something amiss. Sometimes I feel one thing, sometimes I feel another. There is no reason. So actually, they are fighting an unknown enemy 24/7 with no support. So it just takes a moment to reach out. It takes a moment to see if something is amiss. It takes a moment to seek help or to find out what is the best kind of help that this person can be given. So please extend your hand, reach out, be there for the person who needs help. And remember, they don't have to cope alone. None of us has to cope alone. We need to reach out and seek help. Let's talk. So I'll be glad to take any questions if there are any.
Before starting with the question and answer session, we would like to present something on the behalf of Roshini.
Remember to reach out, there's always somebody. Remember to reach out, there's always somebody.
Ma'am, we are live. And ma'am, the video is on screen. It is live. The video and the poster are live.
Okay. So any questions anybody has?
Oh, ma'am, we can start with the Q&A session.
Okay.
So ma'am, there was a question from the audience that is it possible that with the time a person is out of depression and is not having any suicidal tendencies?
Yes, of course, people
Like-
can be. Yeah, tell me.
Like they did not go to a professional, and with time their depression is no more. So is it possible?
Yes, that can happen if it is not clinical depression. Clinical depression is like there is some disturbance in the brain function. So it's like somebody has BP or diabetes, they need a medication, they have to take the medication. But when it is depression is caused because of what's happening in life around us, there may be a loss, there may be a failure, there may be a long-term illness. For that, a person becomes depressed, but as things change without medication also, they can come out of depression. But here again, the support of family, others being with you and supporting you and caring for you make a lot of difference. When one is coping alone, it makes it a little more difficult, but it does happen. People do come out of it. In fact, within 6 to 12 months, a person can come out of it.
Okay, ma'am, there's one more question. This COVID situation, I feel so demotivated, lazy, and lonely. I have sleeping problem, and I don't know what to do.
Yes, I do understand. This is the first time.
This is the question.
Yes, it is the first time for everyone, at all age groups, whether they are children or teenagers. Everybody's feeling the effects of such a long-term thing because of the uncertainty. It seems that life has been put on hold. What we need to remember is there are some things that are within our circle of influence. So the things I can change and influence, I should do it. But there are many things which are outside our circle of influence. I cannot influence whether there will be stormy weather or hot weather, or whether, I take a flight, will that flight land safely? We just go ahead with faith and with the belief that it will happen and everything will be all right. So what we need, this is what really helps us to know how resilient we are. Am I able to cope with uncertainty, with the changing situation, with not knowing what's coming ahead? At the same time, there are different ways of perceiving the same situation. So one is we look at the downside and say nothing is going right. The other is we look at it that I will never get so much time to spend with family. I will never have so much free time on my hands. How best can I utilize this time? Can I learn something new? Can I learn a new skill? Can I, now everything is available on YouTube and Zoom sessions are there. So many webinars are there. So it's just about how you perceive it. It's up to each person. So definitely when one is home all day, there is no external pressure. There is no deadline. There is no, I have to leave. I'll be late. There's a meeting. School bell will ring. Nothing is there. No external pressure. All of it, that internal discipline only can help us to keep going. So we need to have a routine. It's so easy to say, I'll just watch TV, I'll do binge TV, binge eating, binge sleeping. One can just slide into that very, very easily. So one should have a set routine, a timetable, time for what are my productive activities for the day? What is the thing where I'm going to be learning something? What are the ways in which I am going to actually help around in the house? What are the things that I can prepare for? Maybe, I'm in the middle of a session or, whether it's in school or college. Is there some extra reading I could do? Is there something else that I could do to brush up my skills? What are the fun things that I can do? In the olden days, there was no television. So people did resort to board games and, other forms of entertainment with family. We need to just think out of the box. We are so stuck, I can't do this, I can't. Now today, you have so much of technology. There are so many of these social media things. A lot of that also is not good because that also makes one very, feel low and down. There's nothing happening except doing this the whole day. So exercise, get out, do whatever it is you need and utilize this time. Perceive it as a godsend where you're being given an opportunity to maybe follow a passion, take up a hobby or brush up your skills, which you may otherwise not have had the time for. But you need to set a routine. You need to have a timetable.
Sure, ma'am. Ma'am, we have one more question. Many people have a tendency of self-harming themselves and they do not particularly want to die, but they keep on harming themselves. So why does this happen?
So this is actually a form of non-suicidal self-injury. The purpose behind it is to inflict physical pain. And why would someone do that? When the psychological pain becomes unbearable, the thoughts, the mental, emotional, whatever it is that they are being, they're actually drowning in that, and they can't cope with it, then somewhere that physical pain takes the mind away from the psychological pain. So it gives them a temporary relief from the psychological pain. But that's not a solution, because at some point that physical pain, you need to tend to it and apply medication and it heals. The psychological pain will continue. So it's like saying, I'll cut myself, I'll put Band-Aid, I'll cut myself, I'll put Band-Aid. That is just going around in circles. We need to get to the root of the problem, which is what is causing the psychological pain. Is it my thoughts? Is it my negative thoughts? Is it my gloomy views about the future? Is it my situation and circumstances? If I can change or control them, I can do it. If I can't, what is the best I can do? If I cannot do anything alone, can I reach out and seek for help? Today, you even have help for domestic violence. So Roshini also maintains a list of referrals where we can refer you to people or to institutions or organizations, all relating to mental health. Not for other things, all relating to mental health. So you could actually call Roshini and ask that, there's domestic violence going on at home, or I'm being abused and I need help. Talk about it. You will be given the referral and some action can be taken. If you have a family member whom you trust, who you feel can help out, then you must talk to them. Do not hide it ever. Because by hiding, nothing is achieved, nothing changes. It just continues and you just keep spiraling down, 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 down. Maybe there's a little lift, hurt yourself, again down, hurt yourself. That is not, it's just going around in circles. So get to the bottom of the reason for the pain, emotional, mental, psychological pain that a person is feeling. Psychological needs, there are 5 basic psychological needs. We all have a need for love, for belonging and affection, for achievement, for recognition, for security and safety. These are the 5 psychological needs every person is born with. When we feel, we're not aware of it. I don't tell myself, today was this need of mine met. It's not like that, but they're there. And when the needs are not being met, then we begin to feel emotionally hurt, upset, sad, depressed. There are degrees, it's like a scale, and you can go from 0 right up to 100. You could be anywhere on that scale. So get to the bottom of that. Sometimes we ourselves don't understand. That is where talking helps. When you call an organization like Roshini, let me tell you, firstly, it's confidential. It's a free service. There is no time limit. We don't even ask your name, number, address, which city, nothing. There is no time limit. We don't force you to talk about anything you don't want to tell us. You will maybe just start speaking. And as you keep talking, so many things would come out which you yourself would have never shared with anybody. You were not even, perhaps you have repressed it or suppressed it. You've never even thought about it. You've forgotten about it. It's been put into the recesses of your mind. But somewhere it's like peeling the layers of an onion. Slowly, one by one, whatever is deeply embedded just comes out. You talk about it and the relief is overwhelming. It also gives, when all those emotions have vent, like a pressure cooker, the whistle goes off, then you become calm. There is more clarity of thought. You are able to take decisions that, in this situation, what is the best thing I can do? Although Roshini volunteers will not advise you, but we will definitely discuss options, discuss alternatives. We will discuss what are the consequences of each of these actions that you might want to take. And with that clarity in mind, one can actually move forward And if you need, then a referral can be given for a counselor or a psychologist or a psychiatrist. So Roshini, under the Roshini Trust, we also have a counseling center in Hyderabad. And I can share the numbers with you, 040 6666 1117 and 040 6666 1118. So one can call and fix an appointment with, it's like a polyclinic, you can say, for different forms of mental health professionals. Of course, this is a paid service, and you can avail this service. So you can, I would say, like calling Roshini is like putting Band-Aid on a cut. You know, you clean it, clean a wound, put a Band-Aid, it heals. If you let it fester, it becomes deeper and deeper and deeper. Then it might need, you know, a surgery or something else. So if you feel, I just want to talk, call Roshini, and the volunteer, after talking to you, would be able to assess that perhaps you might like to talk to a counselor. Perhaps you think, you know, that might help, and then take it from there. But take the first step. Take the first step.
And there's one last question. How does the side helpline number work?
So we have two helpline numbers, which we had shown. I think you can show that slide again. And we are available, volunteers are available morning 11 a.m. to 9 p.m., 7 days a week. And volunteers speak, you know, many languages. So there's Telugu, Hindi, English, Tamil, Malayalam, Kannada, Bengali, Marathi, Punjabi. Of course, all language speaking volunteers would not be present every day. And we also have a mail ID, roshinihelp@gmail.com. So we get a lot of mails from people who are disturbed, and we reply to them. So it's again, it's like talking through writing, or you talk verbally, whichever one appeals. Now, because of the COVID, the center is not open, but otherwise we have a center in Sikandrabad in Sindhi Colony, and that is also open 11 to 9. And people can actually visit the center and talk in person if they prefer to do that. So there are three modes of contact, and everything is kept confidential within Roshini. We don't ask your name. So we often have students, you know, who visit, in their late teens. And if a parent comes and says, you know, did my child come here? Or a spouse says, did my wife come here, husband? We cannot tell them because we don't know who's how, husband, wife, child, whatever, no. And even if we knew, we would not reveal that information. It is so confidential that if somebody comes to the center, they talk to a volunteer, and few weeks or months down the line, you know, you come across that volunteer in a mall or in a theater, the volunteer would not recognize you, they would not greet you, they would not approach you unless you go and say hello. That only thing the volunteer would say is hello. Nothing else, no bond is formed. They will not in any way show that they know you. And confidentiality is maintained. We've had callers who have, you know, over a period of time, they were calling, but they have moved on and passed away. Confidentiality is maintained even after the person moves on. And it is a totally non-judgmental approach, accepting of any person. So we can have a person from any walk of life, any economic or social status. It could be of any gender. We could have, you know, male, female, LGBT, nothing. For us, they're all human beings who are in pain, who have come to another human being. See, I'm in pain, I can't cope. And we are there to hold hands, not physically, not figuratively speaking. We are there to be with them, to support them through the difficult time until they feel ready to move on, and they would say, thank you so much. I think now I can move on my own. So it's just like you're reaching out for hand holding when you're feeling unable to cope alone.
Thank you so much, ma'am, for this wonderful session and for this insightful session. I personally enjoyed a lot, and more than enjoy, I got to know so much things which as a psychology student, I never knew. So thank you so much, ma'am, for this immense knowledge that you provided us here. And I would like to thank Psychologs Magazine for giving this opportunity for this initiative that we launched. And I just want to thank every participant who participated in this, and who I think that who got to know so many things about this, and who actually felt that they can help someone in their life or anyone who are in need. Thank you so much, ma'am.
It's my pleasure, and thank you for giving us this opportunity. So I think the more people we empower, the better we can make our society and this world. So all the best to all of you who are hoping to be gatekeepers. Please, the good intention, every good act starts with a good intention. So keep the intention and the action going. Let's create hope through action.
Thank you.
Thank you.
Thank you, Drish, and the team of Psychologs for giving us this opportunity. It is a great session, Tinky. Though I keep hearing to her talks most of the times, but every time it's a new session for me. So much of knowledge to gain from her. I hope Psychologs viewers of this session enjoyed the session, and everything explained so comprehensively. I hope they understand and move towards being gatekeepers and help others who are in need. Thank you so much.
Thank you, ma'am.
And
Remember to reach out. There's always somebody.